Welcome back to OrthoNugs. In this video, I'll be demonstrating a hip special test known as FABER's test. And you could probably tell from the name that this test is a combination of motions at the hip, flexion, abduction, and external rotation. We'll talk about more specifics of the test as we're going through the demonstration, but it's typically utilized in the clinic as a provocation test for, of course, hip pathology. It can also provoke SI joint pain. And I also occasionally document the test as positive for hip hypomobility. This test is also known as Patrick's or the FIGURE-4 test. So we bring the hip into flexion, abduction, and external rotation. I'm applying the stabilization force on the contralateral ASIS, and then applying a downward force on the distal femur knee region with my left hand and springing against that resistive barrier, trying to provoke symptoms. Now, this test can be positive for a number of different hip pathologies, so you really need to make note of where the symptoms are located. If they're anteriorly located, it could be a hip capsular issue, could be iliopsoas. It could also reproduce impingement symptoms in the posterior or lateral aspect of the hip. In addition, this test can be positive for reproduction of sacroiliac joint symptoms. The other thing that I'll use this test and document for is hip hypomobility. So you can compare side to side. You can also document how closely the knee is to the table involved versus uninvolved. Thanks for watching. Please like, comment, consider subscribing to our OrthoNugs channel if you feel like this video was helpful to you. If you're interested in learning more about assessment of the hip and the lower extremity in general, I've included a few playlists here for you to take a look at. One is range of motion and the other is clinical strength testing for the lower extremity. Thanks again.